Oral health and mental health are often treated as separate conversations. One belongs in the dental chair, the other somewhere else. But in reality, they are deeply and quietly connected. My name is Dr. Simon Shahid. I am a house officer at Fatima Jinnah Dental College. And today I want to talk about something we encounter every day in practice, but rarely pause long enough to truly see. This is a story about teeth, but more importantly, it is a story about people. The story does not move in a straight line. It moves back and forth between the mind and the mouth, between silent suffering and visible disease, between what patients feel and what we are trained to notice. This map is not just a structure, it's a journey. And once we follow it carefully, we begin to understand how easily one problem becomes another. The objective of this presentation is simple but urgent, to show how mental well-being and oral health continuously shape one another, to explain why this relationship matters across social and cultural boundaries, and to highlight how dentistry can help interrupt this cycle, not only clinically but humanely, because sometimes what looks like neglect is actually suffering. Long before a patient describes pain, their body begins to speak. Anxious stillness, averted eyes, a posture that falls inward. These are not behaviors meant to be noticed. They are quiet adaptations to distress carried for a long time. In this moment, we are not yet seeing disease, we are seeing vulnerability. And if we are attentive enough, this is where the story truly begins. Anxiety does not remain confined to the mind. Over time, it leaves traces. When emotional distress sets in, routine is often the first casualty. Brushing is missed, appointments are delayed, not out of carelessness, but exhaustion. Stress settles into the body, jaws tighten, teeth grind through the night. Pain becomes familiar before it is recognized. Inside the mouth, healing slows, inflammation lingers, damage accumulates quietly. What began as an invisible distress is now written clearly in the oral cavity. As the mouth changes, the mind responds. The mirror becomes difficult to face. Pain interrupts sleep, eating, concentration. Function is compromised, confidence erodes, smiles are hidden, conversations shorten, withdrawal feels safer than explanation. An oral condition is no longer just physical, it begins to shape identity, mood, and self-worth. And once again, the cycle tightens. This is how the fall happens. Not suddenly, but gradually. The mind enters turmoil, confidence begins to crumble. Teeth are left vulnerable, a smile comes under siege, and the mind responds again with deeper anxiety, lower mood, greater withdrawal. The loop turns and repeats quietly, relentlessly. In Pakistan, millions live with depression and emotional distress, often unnamed, often unseen. Socioeconomic barriers place care out of reach. Financial strain, limited access, and competing priorities push both mental and oral health aside. Cultural stigma deepens the silence. Suffering is endured, not spoken. For patients who reach the dental clinic, this creates compound exclusion. Mental distress goes unnoticed, oral health is treated in isolation, and the cycle continues unchallenged. The cycle does not break itself, but it can be broken. For patients, change begins with being seen and believing that care is possible. For dentists, it begins with recognition. In every chair, in every encounter, there is a moment where harm continues or the cycle is interrupted. That moment belongs to us. Hope does not arrive dramatically. Sometimes it enters through the dental chair. By creating a safe clinical space, we give patients permission to exhale. By restoring comfort and function, we make daily life manageable again. By opening the door to further support, we acknowledge what we cannot treat alone. And by lowering barriers to care, we make it possible for patients to return. This is where the cycle begins to loosen. But a dentist cannot work in isolation. What we notice and what we miss is shaped by the systems around us. When institutions train dentists to recognize patterns, care becomes more attentive. When mental health awareness is embedded into education, it becomes normalized. And when the referral pathway exists, responsibility is shared. This is how systems learn to see beyond the smile. As dentists, we do more than treat teeth, we touch lives. Mental well-being shapes oral health, and oral health shapes mental well-being. There is no oral health without compassion. Be attentive, be human, be the one who breaks the cycle.